budget, and of course, consequently, other parts of the NHS are protected too. But that doesn't mean there aren't still tough times ahead for the health service. Our health editor, Hugh Pym, is outside a very famous hospital, UCLH in London. Let's go over to him. Hugh.
Yes, Andrew, we learnt a lot about the funding for the NHS in England yesterday, with quite a significant increase for next year, and then going through to 2020. The settlements for Scotland, Wales and Northern Ireland will become clearer with the detail of the spending review documents. Today we've also learnt there will be cuts in other areas of health. There will be reductions in public health run by local authorities, and student nurses and midwives will have to start paying tuition fees and for their own maintenance and borrow money. And that actually could result in more training places. So I'm joined here at UCLH by Andrew Holdenby of the think tank Reform and Rob Webster of the NHS Confederation. So Andrew Holdenby, first of all, what do you make of the overall health picture with what we've learned today?
Well, I think the Chancellor's taken a gamble today. He's got extra money in this Parliament. He's going to spend most of it at the beginning to try and make the NHS more productive, to cope with tighter money later on. I'm not confident that the NHS will become much more efficient and productive in order to help it in the later years of this Parliament.
Because, to be clear, efficiency savings of 22 billion are still needed by the year 2020, and we haven't really heard a lot more detail on that at all, have we?
The Chancellor's big pitch today was more money. That's the message he wanted to put over. But the thing the NHS needs is more productivity, more reform, and our work indicates that the progress on that is slow.
Rob Webster, what do you make of the specific issue about student nurses and midwives having to pay for their own tuition? Will that deter people coming in, do you think?
Talking to the universities, they've been lobbying for some time to open up this issue so that we get more applicants through and we get more nurses in training. Having a workforce that is committed and supports the NHS as it goes through big change is a fundamental part of the future. And as both you and Andrew have said, we do need to deliver £22 billion worth of savings, and we should welcome the upfront investment to help us to do that. It doesn't make the need for that go away, though, and big changes coming over the next 5 years.
Do you think public health budgets being cut at local authorities will make it harder for the NHS? That's prevention being cut?
Both public health and social care remain a concern to us. A good, shiny NHS cog in a broken machine won't work for patients. We need to focus on prevention. We need to make sure local government can support local people to stay well. And fundamentally, we need to ensure that social care is supported, because older people need joined-up services, whether it's their care needs or their health needs.
A quick word from Andrew Holdenby on this social care issue. What did we learn today?
Well, the government's worried about social care. It's going to let councils raise taxes to spend more on social care, keep elderly people out of hospitals if they can. But that, again, it's not changing the services. Bit of extra money isn't a long-term solution. I would say on the NHS and social care today, no long-term solutions.
OK, Andrew Holdenby and Rob Webster here at UCLH in central London. Thank you very much for joining us, and back to you, Andrew.